bursitis. Now, before we begin and get into the actual examination maneuvers, let's go over a little bit of philosophy about true examination objective findings. Now, Webster's dictionary defines pain as an unpleasant sensory and emotional experience often characterized by evasive action. Evasive action. And we can incorporate that definition into our physical exam by looking for the evasive action. Now, we're going to be examining here for the condition of Trochanteric Bursitis, which is a very painful condition. In the presence of bona fide Trochanteric Bursitis, we would expect to see some form of evasive action. So, how would evasive action manifest? How would it look in a bona fide examinee? How would it look? Well, it would look like a flinch, a jump, a withdrawal, a shimmy, some sort of evasive action away from the painful stimulus. So in this example, we're going to demonstrate two case scenarios. A case scenario where there are true objective findings for Trochanteric Bursitis, and another scenario where the objective findings may not be as definitive. So we have here Mrs. Jones, and Mrs. Jones reports lateral hip pain, and we're going to now demonstrate the physical examination maneuvers to investigate or assess for this condition of Trochanteric Bursitis. Okay, so let's begin our physical examination for Trochanteric Bursitis. Now, the Trochanteric bursa, there is as many as 7 bursa in and around the hip. Now, the majority of the clinically relevant bursa lie right directly over the greater trochanter. There are as many as 7. Most of those can be palpated from the front. Some can only be palpated from the back. We'll focus today here on the ones that we can access from the front. So we have our live examinee, and Mrs. Jones, I'm going to be doing some tests on your hip to find out what's the cause of this pain. If you have pain at any time, just let me know.
All right.
Okay?
Mm-hmm.
So I'm going to just poke around here, around some of these tissues in the hip, and if you have pain, you just let me know.
Okay.
Okay, so poking around here.
Ow, ow, ow. That's kind of uncomfortable.
Pain?
Pain right in there, right where your fingertips are.
Right here?
Uh-huh. Ow. Can you stop?
Pain there?
Yeah.
Gotcha. Okay, let's contrast those physical exam findings with the same maneuvers on the other side. Okay, Mrs. Jones, I'm just going to be poking around the leg a little bit. If you have pain at any time, just let me know.
Okay.
Okay? So just poking around here a little bit.
Ow, ow, ow. Don't do that anymore. That really hurts.
Pain?
Yeah, that really, really hurts.
Okay, so very lightly, just poking around a little bit. Pain?
Pain.
Got it. Okay, let's now move to another physical examination maneuver. And with Trochanteric Bursitis, there are not a lot of physical examination maneuvers on which we can really rely, but there are a few. The first of which, and the most reliable, is pain on palpation. Let's now move to a resisted manual muscle test where we check two things: strength of resisted hip abduction using the gluteus medius muscle, and then also for reproduction of pain with resisted manual muscle testing. So Mrs. Jones, we're going to do some maneuvers on the hip, and what I'm going to do is I'm going to bring your leg out here, and then I'm going to apply some pressure to your leg in this direction. You give me some resistance against my hand here.
Okay, so you don't want to me to let you put my legs together again.
Correct. Don't let me push it inwards.
Okay.
Okay, so give me some resistance here, and if you have pain,
Ow.
you let me know.
Ow. Ooh, that's really hard.
Go
Ow,
ahead.
ow,
Hang on.
ow, ow.
Got pain?
Yeah, that really hurts.
Got pretty good strength, huh?
Yeah, but it
Full out
really
pain?
hurts.
Gotcha.
But it has strength, but I can do it, but that really sure hurts.
Okay. Let's compare that with the same maneuver on the other side. Okay, so I'm just going to move the leg out here to the side.
Nope, stop. That's all you can do. It hurts too bad to go further out.
Can't go out?
No.
Okay, very gently. Let's see if we can get this in position here. Okay, so I'm going to apply a little... You all right?
Yeah, I'm fine.
Hold there.
We'll have you better, but I'll do it.
Good.
Ooh. Ooh.
No?
No,
Okay.
can't do
Got it.
nothing from there.
Got it. And then finally, one of the examination maneuvers that we rely on is Patrick's test. Patrick's test involves combined movement of the hip joint in flexion, abduction, external rotation, and then extension, which will usually exacerbate a hot trochanteric bursa and would reproduce the symptoms. So Mrs. Jones, I'm going to maneuver the leg around a little bit and do some tests. If you have pain, just let me know.
Okay.
Okay? So what we're going to do, I'm just going to put this foot right over here on top of this leg. How's that? Not too bad?
Feels a little weird, but it's okay.
Okay. Okay, so I'm just going to hold that right there. And I'm going to put a little pressure here down on this leg. And if you have pain at any time, just let me know.
Okay. Ow, 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 ow. That
Pain?
hurts. That hurts back here in my hip.
Right. Okay, little pressure.
That still hurts.
Pain?
Yes.
Bad?
It's getting worse, yes.
Gotcha. And let's compare that with the same maneuver on the opposite side. Okay, so Mrs. Jones, same maneuver.
Okay.
Okay, so raise this up here. And we're gonna...
No. Can't turn that. That hurts too much.
Can't do it?
Uh-uh.
Okay, let's try a little different angle.
Okay.
Let's set it right there. How's that?
A little better, yeah.
Okay, so I'm just going to apply a little pressure here. Go ahead and let it settle down.
Ooh. It really isn't comfortable, but
A little pressure.
okay. Ow, ow, ow. That really hurts.
Can't do it?
Uh-uh.
Got it. These would constitute non-physiologic exam findings or questionable physical exam findings. These would constitute true objective findings for the condition of trochanteric bursitis.